So the Keynote-012 study was initially started almost 3 years ago to determine if there was any activity of Pembrolizumab, the PD-1 inhibitor, in recurrent metastatic squamous cell carcinoma of the head and neck. All patients had recurrent and metastatic disease. The majority of them had had prior platinum therapy, and over half of them had prior platinum and cetuximab and had progressed on those agents. So the initial cohort used a different dose of 10 milligrams per kilogram every 2 weeks. Patients in that cohort were required to have PD-L1 positivity in their pre-treatment tumor sample. The subsequent cohort used a fixed dose of 200 milligrams every 3 weeks, and it was unselected with regards to PD-L1 status. So in the combined analysis, both cohorts, it was a total of 192 patients. The response rate amongst the entire population was about 18%. The progression-free survival median was 2 months, and the median overall survival in a fairly heavily pretreated population was 8 months. What was compelling, though, is that given the long period of follow-up on this study, the last patient was treated over 16 months ago. There were patients who did have CRs, and there were patients who completed the specified 24 months of therapy and are now in follow-up. Well, both HPV positive and HPV negative patients had responses. Well, PD-1 inhibitors and Pembrolizumab does have activity in recurrent metastatic squamous cell carcinoma of the head and neck. So hopefully this will provide us with future treatment options for our patients and provide a backbone for future studies.